Hello, everyone. My name is Travis Rourke. I'm an internal medicine resident at Scripps in La Jolla, California. My research is on trends in alcohol-related disease during the first year of the COVID-19 pandemic. And some introductory information, we know harmful alcohol consumption rose during the COVID-19 pandemic in those under stay-at-home orders, and this is thought to be due to the mental health exacerbations caused by this isolation. So we investigate the health outcomes caused by increased alcohol consumptions by examining post-outbreak rates of alcohol pancreatitis, alcohol-related liver disease, and ED visits and hospital admissions for alcohol intoxication and withdrawal. We did this by examining our patients at Scripps Health. This is a regional healthcare system including 5 hospitals, 28 clinics, and treating about 700,000 patients annually. This is a retrospective analysis using EPIC slicer dicer and ICD-10 codes. We did z-score analysis to look for months of significance compared to the control, which we used as the cases in the year prior to the COVID-19 pandemic. We used publicly available San Diego County COVID-19 data to compare with Scripps Health data for cases diagnosed here. And you can see in blue is the cases diagnosed at Scripps, and the orange is the San Diego County total, seeing that we have a very similar trend with about an order of magnitude difference. We also looked at alcohol sales using an available database through the Federal Reserve. This was monthly alcohol sales from 2017 through 2021. And you can see that starting in June of 2020, there was a $2 billion increase in monthly alcohol sales. Our results we show here in these different graphs. What you can see is these light blue bars represent the control months. These dark blue bars represent the cases during the first year of the COVID-19 pandemic, starting in May of 2021. And down here, this is our z-score analysis. Any z-score value above 2, which was our cutoff for significance, is highlighted in orange. And what you can see here is that there was a significant uptrend in all of these different diseases that we looked at associated with alcohol consumption starting in the summer or fall of 2021. In summary, Scripps Health COVID-19 cases closely mirror those of San Diego County. And during the COVID-19 pandemic, there was a $2 billion increase in monthly alcohol sales beginning in June. Over the same time period, there was a significant increase in alcohol-related health complications within Scripps Health, which we have broken down here in Table 1. You can see here these light blue values represent our control monthly mean. These dark blue values represent the case mean. And then these orange values represent the subgroup monthly mean that is calculated based on when the first month of significance started for each of these disease processes. So these findings highlight some of the hidden costs associated with the COVID-19 pandemic. We also see that there was a 2 to 3 month delay between the initial stay-at-home orders and the increase in alcohol sales, as well as health complications, suggesting that shorter periods of isolation don't carry the same risk that longer periods of isolation do. We saw increased cases of alcohol pancreatitis and alcohol hepatitis that correlated in real time with alcohol sales. Surprisingly, though, there was a lag in cases of intoxication and withdrawal that you can see down here, not starting until October. We suspect that this might be due to people being in social isolation, preventing intervention from different support structures that they previously had, or that patients were simply deferring medical care out of fear of being exposed to COVID-19 in these healthcare settings. Our study also demonstrates the utility of using EPIC slicer dicer as a user-friendly tool for real-time analysis of electronic medical records in a de-identified manner. As we integrate artificial intelligence into EMRs, we might be able to use, for instance, rising ICD-10 codes for alcohol pancreatitis as a harbinger for changing patient behavior like increased alcohol use. And lastly, it is important that we investigate the hidden consequences of the COVID-19 pandemic to better understand the harms and benefits of these aggressive public health measures. Thank you very much for your time and attention to this presentation, and I look forward to seeing all of you at ACP this year. Thank you very much.